Hi everyone, this is Brian Dormer and I'm your instructor for Clinical Anatomy 1. This is either on Monday afternoons from 3 till 6 or Thursday evenings from 5 till 8. So being that this is Clinical Anatomy 1, I want to go through just a couple of things. This may be a repeat for some of you from some of the material, not really just my introduction of me from your AMP1 class, but again, it's Brian Dormer. There is my email, brian.dormer@georgiancollege.ca. My office is M320F. My extension is 1461. My phone number is there to be contacted. The first thing I'd like to do is go through the formal stuff, which is the outline and the syllabus. There is one thing that's slightly different here as compared to the AMP class, and that's something called the study guide. So the first thing I'd like to go through is the syllabus. Again, you see here my contact information. My office hours I will be announcing, I'm not sure when, but as I can see here, 3 till 6 on Monday in M335 or Thursdays from 5 till 8 in M329. The classes those are both in the same building as my office. You'll see here that it's a pretty packed schedule for this class this semester. I will tell you that there is a lot to go through. There are some expectations by me in regards to you doing work. There's going to be a lot of work involved in this course. In fact, the reason I have the study guide is there's also going to be some self-teaching as well, although I will be creating screencasts very similar to this for some of that information. We'll get to that a bit later. Ultimately, this course is connected to Practice Consolidation 1 along with your Massage Theory 1 class. In the past, we had it all separated in their own labs, and we felt that students weren't amalgamating the information. Everything you do in this semester from a Massage Theory, Clinical Anatomy 1, they're all related. So imagine, if you will, that this class is about learning all the bones, joints, and muscles of the axial body. Massage Theory is about learning to massage the body, and there is a relationship between what we do with our hands and what we do knowledge-wise in our clinical anatomy class. So you'll see here as we work our way through that this week is introductions of the course and the beginnings of osteology, which is bone. Next week will be the introduction to the joints of the body and introduction to muscles. And then by week 3, we are actually getting into formal anatomy of the head, face, and skull, and also the muscles there, and that will work its way through. So by week 4, it's the spine, typical vertebra, and the joints of the spine, and then we get into the specifics of the cervical spine, some muscle testing as well, and then the thoracic spine, muscles of the thorax. Back here was also muscles of the cervical spine as well. And then on and on and on all the way through. Our midterm for this course is not until week 8, but you'll note over here there are weekly courses every week, or just about every week, specific anatomy tests that are throughout in the first half. So the idea is that by the time we get to the midterm in week 8, we have taken all the bones, all the ligaments, all the muscles of the axial body, which includes all the thorax, which would be your abdomen and your ribs, muscles related to the rib cage and so forth. The second half, weeks 9 through, at this point, 11, thinking 12, I gave myself a bit of a buffer here. Depending on how things go, we could be using weeks 12 and 13. We may not be, but this is all your physiology. This is all the architecture of skeletal muscle, muscle contraction, the relationship between the nervous system, and so forth. So you'll see here then the quizzes are here. I may be reworking this a little bit, but we can see that things are breaking down. We have the quizzes. I'm taking your best 6. We have anatomy tests, your midterm, and your final written for a total of 100%. There are a number of books here. One is missing because I'm double checking it, which is your remedial exercise book, but at this point it is Moore's Clinically Oriented Anatomy, the muscle testing book, the muscular system manual, the principles of anatomy and physiology, and the trail guide to the body. If I go back to learning the muscles here, which we see in the various parts here. So the muscles of the cervical related to the cervical spine, thoracic spine, and so forth. Please, I ask you to use this book, the Muscular System Manual, for the information of your origin, insertion, and actions. There are some relationships to here, so the second book would be Moore's, but please do not use Tortora as your default for actions and attachments, and definitely do not use the trail guide. In fact, there are some mistakes in the trail guide that I'd rather you didn't use it. The trail guide is used to learn how to palpate the structures I'm going to be teaching you in this course, ultimately, but we're not using this as a direct reference guide to the attachments of the muscles themselves. So again, lots to do. It's going to be a very, very, very busy semester, and we're going to be moving along pretty quickly, but I think you'll do fine. Semesters prior to you have been able to do it, so I think working together, I think we'll be perfectly fine. The next document I want you to see is the course outline, which I did have here somewhere, and I'm not sure where it is, so we're going to bring it back up again. There it is. The course outline here is, as you've probably heard from a number of your teachers, the sort of the formal contract between you and I and the college. It does list, has a description of the course, so as I sort of alluded to, it's the study of the bones, joints, and muscles of the axial body, which includes the theory of stretching and strengthening, trigger points, and proprioceptive neuromuscular facilitation. This is going to help you when you enter into the clinic, and this, as I mentioned earlier, this content is reinforced in the Practice Consolidation 1 lab, which is your 6-hour lab per week. Here is all the content that we will be taking. And your outcomes are here. You're going to be able to identify the bones, muscles, and joints of the axial body. You're going to be able to explain the current theories on stretching, including neuromuscular facilitation. Muscle testing as well will be discussed in the class, and so forth. So as I have said in a couple of classes, this formal course outline, you want to keep it somewhere under lock and key. And you may be required to use this for exemptions and another course you may be taking, so that's why I'll tend to reinforce that you maintain a binder, an electronic binder of this material of your outlines, so that you may need them for future use. The next document I want to review with some importance and some time is the semester study guide. This semester study guide is an integral part that I've added. This is going to be new. It's exactly what it says it is. It's a week-by-week highlight of things to consider when you're studying, pages to go to, and so forth. So I want to read this formally. The study guide was created to help you better prepare yourself for this semester and future semesters. You will find key points that are integral to being successful and help you remember the information you'll be learning this semester. There are a number of areas that you need to familiarize yourself with. First, there are key points of information every week that are a must to know. In this program, you are expected to remember what you learn in every semester and in your future career of massage therapy. I always speak to students about how you come from a system that you work hard to remember information, you have a final exam, and then you never ever think about that material again. That can't happen in this course. Everything that you take is something you must remember, because you may come across it, whether it's a disease that's discussed in semester 3, whether it's a test that you need to do that's discussed in semester 3, whether it's a technique that you learned in semester 1, and so forth. You must remember everything here. So the idea of cramming nights before tests, that's not going to help you and not going to work for you. I am going to talk a little bit about that when we meet, but something I want you to think about now. Studying these key points will help you learn, but please remember, anything and everything that is in the syllabus, included in the readings, the materials provided in class, and anything taught in class are or will be found in any of your tests and quizzes. Everything is free game. So you might want to attend classes as much as you can. When we are going through material, all the pages of all those textbooks, I've taken the time to put in the syllabus for you. So there is an expectation that you pre-read prior to class. You don't have to go searching through the chapters. I've given you the pages that you require. Pre-reading does not mean pre-learning. It's a matter of going through the material, highlighting key areas, highlighting areas that you don't understand, and ensuring that whatever I talk about in class, I am helping you learn those things. Number 3, there are components of self-study in this course. What does this mean? It means that I will not be formally teaching this material, and although I may not formally teach it, you are expected to know this information. Fundamentally, this means all the muscles, their attachments, actions, and nervous innervations are part of this course. This does not mean that I won't be addressing them in some manner. This may include case history review, group work review, or questions found in many of the quizzes or tests. I have also decided, which is not written in here, that I will be doing screencasts like this for all those muscles. But fundamentally, in the classroom setting, I will not be formally standing up teaching those muscles. You will be expected to work on those for yourself. On page 3, I've included a chart that you might find useful in formally recording this information. I feel it will help you organize all of this material. You will also find that this chart includes components of the Practice Consolidation Lab 1. I feel that filling this chart out will help you to connect the material from this course and to your hands-on lab. So you can see I've got it on a page all its own. You can do this a number of ways. You can copy and paste this and go week by week. You can print off a whole whack of these and do it by hand, writing in. It's however you wish to, but it gives you an opportunity to put the structure that's being talked about, the attachments if it's a muscle, how to landmark it in the palpation class in the lab, how to confirm it in the palpation class in the lab, what is the action of the muscle, and what nerve innervates it. So for some of you, this might be a really handy tool to list things out to keep track of everything that you're learning. So what does the study guide look like? Let's do week 1 first, which I'll be doing here in future screencasts. The key points are listed here of all the things that I'll be talking about, as well as prep for the following week. So I did allude to pre-reading, and that's where the week for prep for week 2 is. So anything here in the prep for the next week, any of the pages that are related to this content will be found in the syllabus. So you won't get lost, just go to the syllabus. The pages for all the textbooks are there, and it'll relate to all the stuff that I've listed here. And I've also got some appendixes here, which we'll get to in a moment. Self-study, I've also got occasionally something about self-study which formally lists things out a bit more for you. Again, key points from week 2, self-study for week 3. This is where, as I mentioned earlier, you'll be doing the work studying the muscles. All the muscles that are required are listed here, and the pages are from the Musculinal Muscle Manual. So that's the only book you'll use for your attachments and nervous innervation. So these pages are from the Musculinal Muscle Manual. You'll see I work my way all the way through. Oh, and as I said earlier, any muscles that are in this list, I will be doing screencasts like this, which will help you further learn those muscles. I want to work my way all the way down to the appendices. When I am talking about the bones in week 2 and 3, and in your possibly in your lab, there are terms that are given to bumps, dents, and crevices that we find in a bone. Bones are not exactly smooth. They have bumps and ridges and holes and all sorts of things in them. This is a nice little list that gives you the name and what that means. So for example, a crest is a prominent ridge, a spine is a sharp point, a facet is a shallow surface for articulation, and so forth. So I'll be going back to this in class, but it is something that you can keep. In the syllabus, I said that you had to learn trigger points. Now I know you don't know what a trigger point is at this point, but what I have done here in Appendix B, I have a diagram for every trigger point that you need to know this semester, and they're all in diagram form here with the name, the referral pattern, and what page you can find that muscle in your trail guidebook. Again, name, referral pattern, page, and trail guide. The other thing you'll see here in the box is the description of the referral pattern of the trigger point. So every muscle that we'll be working on with a trigger point, in the box here, I have listed the referral pattern for those muscles or for that muscle. So hopefully you will print this off, maybe some of you in color, because I think color kind of helps to give you an idea, especially with the trigger points. I would highly recommend printing this off, bringing it with you to class, using it to study with when you're at home, taking it to lab to reinforce anything that's going on in lab, double checking. And this is a guide that will help you with your study processes as you work your way through this semester. And of course, when we meet next week, or this week for some of you, certainly open to any questions that you have about the guide, and I'll probably bring it up in class to go over it one more time. So let's go back to the slide set. We've gone through the course outline, we've gone through the syllabus, and we've gone through the course study guide. The next question is, what is anatomy? Just want you to sort of answer that question for yourself. We did talk about it to some degree in the other class, but some of you may not have got through those slides yet. The second question is, what is physiology? And again, we'll go through that when we meet again. So I did redo this in the A&P class, but I just thought I'd like to review it here because it's a reminder that anything that I tell you about where things are, how they relate to each other, we will always default from this anatomical position. Remember, the individual is standing erect with the palms faced forward. So always remember that when I'm relating information, one thing being close, being lateral medial to another, it's all predicated on this anatomical position. The next is a review of the body planes, which we talked about. Remember, the frontal plane is also known as the coronal plane, divides the body into an anterior and posterior. We have the median sagittal plane, which divides the body into equal left and right. Remember, if the median plane moves away from the center, it's called a parasagittal plane. We also have the transverse plane, which divides the body into a superior and inferior. So the mid-sagittal plane, remember, right and left. Down the middle is the mid-sagittal plane. Anything not in the middle is the parasagittal. The transverse plane divides the body into inferior, superior. The coronal plane divides the body into anterior and posterior. That should be a review for pretty much all of you, having done it through the A&P class. As a review again, we have to remember the directional terms. Again, directional terms can talk about how something moves. They can also talk about how something relates, one structure relates to another structure. So remember, superior is above or upwards, inferior is below or downwards, anterior is to the front or in front of, posterior is to the back or behind, dorsal is exactly the same, to the back or behind, ventral is to the front or anterior, same word used there. Medial is to the middle, lateral is to the outside. New one here is contralateral. Contralateral means the opposite side or the opposite direction. So I could say that a muscle is a contralateral rotator, which means the muscle on the right moves something to the left. That's what contralateral means. Proximal is closer, distal farther away. Superficial is exactly that, and deep is the opposite. Internal and external is used in rotation of limbs. So a limb that rotates away from the midline is said to be external, and a limb that rotates towards the midline is said to be rotating internal. When we look at something that's working both sides at the same time, right and left, it's said to be bilateral. When it works one side only, it is unilateral. Now I said the contralateral was a muscle on the left moves things to the right. Ipsilateral is the same side, which means a muscle on the right would move things to the right. Get to know these. I'm going to be using them a lot in class and reminding you of them over and over and over again. So will all your other classes. So don't worry. I guarantee you that probably by midterm, you will have these down and they'll just be second nature to you. This body of ours doesn't sit still. It moves. and there has to be some way to express all the movements that happen. The thing to remember when we talk about terms of movements, again, the reference goes back to the anatomical position. When we think about movements, they occur within and around axes aligned with specific anatomical planes. So remember your coronal plane, your sagittal plane, and your transverse plane. So although joints move around an axis, the limb actually moves across the plane. When we have movement at a joint, there has to be two bones that come together with cartilage. So I say that most of these movements occur at joints where two or more bones or cartilages articulate. So when bones come together to form a joint, we say that they articulate. Now we do have a number of structures that are non-skeleton, which do moves such as your tongue, your lips, and eyelids. So we don't have a bony joint per se at those structures, but the muscles do influence those areas to move. So when we say something is moving in flexion, it is bending in a way that decreases the angle between the bones or parts of the body. And in most cases in the body, it is in an anterior direction. So if you think of our arm and we just bend our elbow, which brings our hand up to our shoulder, you are decreasing the angle between the two bones of the arm, forearm and the arm, and you are bringing them closer together, so it is flexion. Extension is the exact opposite, is the straightening or the increasing of the angle between the bones or parts of the body. And in most cases, this is in a posterior direction. So if we stay with the elbow, bringing the hand up to the shoulder was flexion. Taking the hand away from the shoulder and straightening the arm out is extension. Now, number 3 and number 4, dorsiflexion and plantar flexion, these terms are used for the foot or the ankle. So dorsiflexion is lifting the big toe up off the ground. So imagine your feet are on the ground, your heel stays on the floor, you bring your foot up towards the ceiling, that is dorsiflexion. Whereas the opposite of that is plantar flexion, and that would be you standing on the floor and bringing yourself up onto your tiptoes. So you're pushing the foot down towards the floor. That is called plantar flexion. Now, you can have such a thing called hyperflexion and hyperextension. This is those folks who we say are double jointed and are able to move joints beyond what's considered the normal limit. Abduction, I always say it that way in class, which makes it abundantly clear. Abduction occurs along the frontal plane and is the limb moving away. So imagine your hands are down by your sides and you move your hand away from your body, bringing it up towards the ceiling from the side. So that would be the frontal plane from the side. That would be abduction. Adduction is the exact opposite. Now your hand, say, is out to the side, and along that frontal plane, you're bringing it down towards and touching your hip. That would be adduction. You are bringing it towards the median plane or adding it. The next is circumduction. Circumduction, imagine an ice cream cone with a very small bit of movement at the point and a larger cone at the top. So if you take your hand and just make it go around in a circle, you are doing circumduction. Circumduction is not a pure movement because circumduction to work properly requires flexion, abduction, extension, and adduction all together to work. Number 2 is rotation. That is the turning or revolving a part of the body around its longitudinal axis. Medial rotation brings the anterior surface closer to the median plane. Internal rotation takes the anterior surface away. That would be external rotation. There's a typo there. External rotation takes the anterior surface away from the median plane. Pronation and supination is basically used more often than not with the hand. Let's do supination first. Imagine bringing your palm towards the ceiling as though you were holding a bowl of soup. Supination, bowl of soup. Pronation is the opposite. It's bringing your hand around so that your hand in the anatomical position is facing backwards. Eversion and inversion are related to the ankle and the foot. Eversion is the movement of the sole of the foot away from the median plane. So imagine trying to take the bottom of your foot and bringing it around to face out to the side. Whereas inversion is the exact opposite. It's bringing the bottom of your foot to turn in such a way as to face in towards the other foot. Opposition is a unique movement that occurs at the hand, and that is bringing your thumb across to touch your little finger. Reposition is from the position of opposition back to the anatomical position of the thumb. So we did, if we look back, we did opposition, bringing the thumb to the little finger. Reposition is taking the thumb away from the little finger back into the normal position. Protrusion is sticking your lower jaw forward, so making it stick out. Retrusion is pulling your jaw back. Protraction and retraction usually with the shoulder. So protraction is bringing the point of your shoulder towards the front of the body or towards the wall in front of you, where retraction is bringing the shoulder back, as though you were doing seated rows for some of you who work out. Elevation and depression more commonly is used, bringing the elevation, bringing the shoulders up towards the ears, and depression, bringing the shoulders down. Elevation is also used when you close your mouth. The bone of the lower part of the jaw moves up, so to close your mouth is elevation, to open your mouth is depression, as well as the eyes. Depression is closing the eyes, elevation is opening the eyes. Okay, those are the movements. Get to know them. They will get used a lot in class, as I said, for all your classes and all your teachers, so I wouldn't be too worried. You'll get lots of reinforcement. We'll be using it all the time. Myself, like most of the teachers, will continually be reminding you what those mean as we talk them through in the lectures. So, surface anatomy. So the anatomy we've been talking about is taking a bone, holding it in your hand, spinning it around, looking at it. Maybe in a cadaver, you're grabbing a muscle and looking at it. But what does surface anatomy mean? The body, when we look at it via the skin, is smooth, but it's also lumpy. We see contours, we see lumps, we see bumps, and all those contours and lumps and bumps represent something underneath the skin that's pushing against it. So surface anatomy is understanding of what lies under the skin. So what do you think we do? We do that a lot. If I'm massaging someone, I am feeling things under the skin, through the skin as I'm massaging them. This is known as palpation. We can also determine to some degree what's under the skin just by looking at the human body through observation. But we find much, much more through palpation or touch. The understanding of surface anatomy can allow us the first indications of unusual or abnormal conditions. So my ability to see you standing there and something looks out of balance or it's sticking out wrong may help me get an understanding of something that may be going on wrong with you. And the thing to remember about how I know this, and you will know this is a good understanding of anatomy. So the harder you work on your anatomy and the more you know, the better you will understand what it is you're either looking at when you're observing a patient or what you're touching when you're palpating or even massaging a patient. That ends the slide. Thanks for listening.